All right. Well, I want to get started right away because we've got a full agenda today. Just a couple of quick announcements before we dive into things. Just a reminder, if you haven't already, send us your nominations for the Golisano Award so we can get the plaques mailed out to you and you can give them to your honorees. At this point, most programs have been approved for their funding for the year. So if you have not gotten an award letter from us, please reach out to your regional health manager and make sure there isn't something that's overdue or missing that's keeping you from getting that, that notification of funding. And, but everything is moving along for programs to get those funds as soon as possible. And also just a reminder, if you asked for funds to be held back for in-person events and your program is now able to open, you can send us an email that says we're open, this is the phase of reopening that we're in, and we're able to accept those funds now, and then we'll be able to wire the additional funds. And as we were kind of talking about before the webinar got started, if your country or state is kind of opening up and then closes back down and you're not able to spend those funds for in-person events, you can always do a budget redirect and move those to virtual activities or things that you're able to do at home. And the last reminder is just that monthly reports are due on the 5th of each month. If you haven't sent us one of those for this month, please get those in soon so we get most of our information to share back with our funders about all the great things that you're doing in the field. There'll be one due in September, but not October. Because you'll have your mid-year report. And that's the majority of what we want to focus on today is mid-year reporting. And I'm joined by my colleagues Molly and Lilia, who are going to talk us through both the reporting in Qualtrics, and then Lilia's going to share some tips about capturing really good stories so that we have those as well. Good to have numbers and stories. So I'm going to turn off my video feed just to make sure that things don't get slowed down here and turn it over to Molly.
Great, thanks, Annalie. I'll start us off with the really exciting numbers portion of this. So I'm just gonna share my screen first for you all. 1 second. Okay, you all can see my screen, right? Great.
Yep,
so, hi, everyone. I think I've met most of you, but my name is Molly Stowski. I'm the Senior Manager for Research and Evaluation, and we'll be walking through the reporting process for this year for the mid-year and end-of-year reports. So we'll go through a little bit of the timeline, spend some time talking about the process of reporting, and then the majority of the time we'll walk through the tracking tool that you all should have received that was an Excel document. So just as all of our activities were consolidated into fewer grant applications this year, we have also consolidated the reporting. So all of our programs receiving a Health Impact, a Healthy Athletes, or a Family Health Forum grant will be required to report on your activities twice throughout the year. So the mid-year report, the most imminent report, is going to be due on the 15th of October, and that is going to reflect all of your activities that took place between the 1st of April of this year and the 30th of September. The end of year report is going to be due at the end of March, and that report will be cumulative and reflect all of the activities that took place throughout the entire year. So we will be using Qualtrics for our reporting this year. Our hope is to eventually have all of the reporting take place in Smart Simple, where you did your applications. That is the dream, to have everything all in one place in a seamless fashion. But for now, we're going to continue using Qualtrics. And on that note, we know this year looks a lot different due to the COVID pandemic. The reporting structure is an attempt to really account for the changes in programming you may be facing right now, including sort of the general shift to online and virtual activities. So please keep that in mind as we're going through some of these metrics. So the main tool that you'll want to focus on for successfully reporting in Qualtrics this year is going to be that tracking tool that we shared. And so we'll spend the rest of the time sort of going through that tool in depth. I will try to pause as often as possible for questions and try to answer them as they come in. I know we have a smaller group than we did this morning, so please feel free to just speak up and ask your questions as they come up. You can also put them in the chat, and Annalie will help me monitor that, and we'll get all your questions answered. So the sections of the tracking tool follow the structure that you used when you submitted your application, and they also include your Healthy Athletes events. So whereas in the past you've submitted your Healthy Athletes capacity grant evaluation reports separately, then for example, your mid-year reports for Healthy Communities, everything is going to be reported in one place this year, and that is in this report. So if everything in your tracking tool is complete by the time you have to submit everything in Qualtrics, this process should really only take about an hour. For those of you who had a chance to look at the tracking tool, I know you probably don't believe me and it seems like a lot of information. So I wanted to also provide a little bit of context around the additional information we're asking this year before we dive right into the tool. So of course, we always use all of the information you all report to us, but I just wanted to mention that this year is especially important as we head into a new long-term 5-year health strategy. We really, really want to use the work that you're doing this year to help inform that strategy and really move us forward as an organization. Again, obviously COVID has forced us to adapt as well. So we wanted to make sure this report reflects everything that you could possibly be doing virtually, how your program has pivoted, how you've developed and created and disseminated resources to your athletes. So we wanted to make sure there was a space to capture all of the things you may be doing, because we know that not all programs are doing the same thing right now. So I'll start just with the first section. That's the general information section, which is essentially a summary of everything else that's located in the tracking tool. So you can think of it as an executive summary of everything that you're doing throughout the year. So this first metric we'll ask for is the number of athletes across your entire program. That one is pretty straightforward. We will ask specifically about the number of athletes in your geographic focus area for programs that have one. I know not all programs have a geographic focus area. Healthy Communities programs are encouraged to select one, but if you don't have one for your activities, when you're prompted, you'll just write program-wide in the space where it asks for that information. If you do have one, you'll tell us how many athletes are participating within your GFA. And then if you don't have one, you'll just write NA there. We are asking you to estimate the number of individual athletes who participated in your health activities. So for example, if your program is just reporting on healthy athlete screenings, this is going to be just the number of athletes screened. But if your program also emphasized follow-up care and ongoing wellness, you'll want to provide your best estimate of the number of unique individuals across all of that programming. This last question helps us understand the overall impact of your programming on your athletes. So have you noticed any changes in athlete health or sport as a result of health, fitness, and wellness programming? This is where you're going to want to tell us about how you've expanded that programming through the support of these grants. This next section within the general information tab focuses on COVID specifically. So we've added these questions to really understand the impact on the impact of the pandemic on our athletes. So we recognize that some of these are going to be hard to obtain and they're by no means required, but if you do have this information, this is the place where you can provide it. So regarding this first question, tell us generally how you've adapted your programming this year given the pandemic. Have you provided resources to athletes and families? Have you implemented virtual fitness activities? How have your athletes been involved in this pivoting process? If you have any specific stories here about how you've adapted that programming, this is where you'll put this information. These last two I know are difficult to obtain. So again, if you happen to be tracking this information anyway as a program, we would love to know this information as well. So I'm going to stop this share and just share the tracking tool directly with you all, and then we will walk through the rest of the tool. Okay, so this first tab gives you an overview of just how to navigate this document. There are several built-in formulas throughout all of these tabs just to make this process as simple as possible for you as you're tracking your activities throughout the grant period. And so each section here, again, is going to correspond with a section of the report. And that, again, also matches the specific section on your application. Some of the questions that will be included in the Qualtrics report may not necessarily be relevant to your program. So if this is the case, you will have the opportunity to skip questions and flow through the report pretty seamlessly to complete just only the information that is relevant for your program. These are all links, so they're just another option to sort of navigate through this big spreadsheet. And we just went over the general information section, so I will just jump to the Healthy Athletes and Referrals tab. Before I move on, Annalie, was there a question that potentially came in the chat? I thought I saw something pop up.
It was just whether we would be able to share this presentation, and I just shared back that we're recording, and we'll post this on the resources website in the next day or two.
Great. Oh, that's great. Okay. So this is where you'll keep track of all of your Healthy Athletes event data. So again, you won't be submitting your event data separately like we've done in the past. Everything is going to be included in this report. So in order to be ready to report everything in Qualtrics, we've developed this tool for you to be able to essentially just copy and paste this into the Qualtrics link. So if you are receiving a Healthy Athletes Capacity Grant, your award number can be found on your award approval letter, and it's going to be that 9-digit number that starts with the letter Y. So if you are receiving a Healthy Athletes Capacity Grant, it's really critical that we know this number as well and you report it. We'll want to know if the event took place in your geographic focus area. So there's also these built-in drop-downs throughout the entire tool so that you don't really have to write anything in unless there's a free text option as well. We'll obviously want to know the date that the event took place. SOI funds spent should include the actual costs and not what was projected in your application. So make sure this reflects what was actually spent. The value in kind, as I think you all are aware, is a donation of goods and services rather than a cash contribution. And a monetary value is given to a particular item by the donor. So do not count volunteer time or staff time in this number. Cash is going to be the money that your program brought in and used toward this particular Healthy Athletes event. So for example, if you held a polar plunge and you used the money that was raised toward this Healthy Athletes event, you would record that as cash. I believe we used to ask for both of these together, just total cash and VIK. We are asking you to separate them out this year. And then just a note to please remember to submit your detailed financial documentation to your regional health manager. So things like receipts, you'll still have to submit to your regional manager outside of this form. This is just an example of one event where a program held every single Healthy Athletes discipline. So there are these built-in drop downs here. So you'll tell us which disciplines were hosted at the particular event, whether it was the first time you've held this discipline, if it was the first time you held this discipline at this particular location. And this helps us understand expansion of your Healthy Athletes events within your particular program and across the region as well. One thing that is different this year is that we are asking you to tell us about the age breakdown of athletes that participated in Healthy Athlete screenings. So prior to this year, we had asked for just a combined number of athletes of all ages. If you do have the information available, we would love to have it as broken down by these particular age groups. If you just don't have that information on hand, there will be an option for you to just enter the total for each of the disciplines as well. So I will move over to this just referral area of this. And remember that to meet Healthy Communities criteria, for those of you this applies to, you'll have to ensure that at least 70% of athletes referred for care at Healthy Athletes have a place to go for follow-up care. So this is how we'll sort of assess that and understand whether you're meeting that criteria. So within each discipline, we'll want to understand the total number of referrals. Of those referrals, how many athletes had a confirmed place to go for follow-up care, and subsequently, how many athletes were confirmed to have received that care. We ask a couple of questions next about whether or not you follow up with family members or caregivers about particular screening results, and how you are connecting athletes to care beyond Healthy Athletes, whether or not you have a list of healthcare providers for those referrals as well. We need to know the number of volunteers that participated in each of these events. So clinical volunteers, student volunteers, and then non-clinical volunteers, which could be just sort of general day of volunteers that show up to either help with setup or help with breakdown. That's where you would capture those individuals. We'll also want to know the number of and the type of giveaways or medical devices for each discipline. And so there's these built-in drop downs that you can select for Fit Feet, for example. If you're giving away socks or shoes, you'll be able to tell us about that here. And then in the next column, we'll want to know specifically how many of that particular item you happen to distribute at this event. As we scroll across, there is a free text option here to tell us about the overall impact of this event. And so this is where you'll tell us about sort of your best success story. I know that we get a lot from Healthy Athletes, so this is the place to talk about that. And I know Lilia later in this presentation will talk about the best ways to incorporate some of the quantitative numbers and the qualitative stories to tell a really good impact story from particular events. So I will just move on to the next tab, which is the referrals and developing a network of healthcare providers section. So this year we'd like to understand specifically how you're connecting athletes to the health system or a referral network. In the previous section on Healthy Athletes, we focused on specifically through Healthy Athletes events, how are you focusing on connecting athletes to care who receive referrals within the Healthy Athletes network. And this section, we want to just know a little bit more about that, like how you are connecting athletes specifically to care. How are you tracking the referrals that athletes receive at Healthy Athletes? Are you following up with athletes and their families after events? Do you have a list of providers that you share? And again, here you're encouraged to share specific stories about someone who may have received follow-up care as a result of attending Healthy Athletes. So this year, we're also asking a few questions related to outside of Healthy Athletes and the Healthy Athlete system. So we know this is a very different year, and it's possible in-person or even virtual Healthy Athletes events may be few and far between. And so we know that programs are also getting really creative with how they're connecting athletes to care. And so these next couple of questions just aim to capture outside of Healthy Athletes. Are there other ways that you may be focusing on connecting athletes to care? So similar to the Healthy Athletes questions, we'll be asking for the number of referrals outside of Healthy Athletes, number of athletes with a confirmed place to go, and then number who have been confirmed to have received care. I will move on to this next section, our year-round health, wellness, and fitness activities. So we are asking for the total number of health, fitness, and wellness opportunities, and that should really capture everything across all of your health and fitness programming. So if, for example, you ran 2 SoFit sessions, Performance Station, and 3 virtual workouts on Facebook Live, you'd report a total of 6 opportunities here. And just to note that these columns are separated into your mid-year numbers and beyond that. And then this will automatically total the 2 periods of time so that for your end of year report, you can just pull this number in this final column here. So we'll need to also know the total number of schools that are participating in health, wellness, and fitness programming for students specifically. So we know programming in schools may be difficult this year, but please focus on counting schools who could potentially be hosting virtual health, wellness, or fitness opportunities as well. And don't count schools in which you're only using the school facilities for activity space. Again, given the current environment, I'm not sure how often this would be happening, but we want to make sure we're capturing the number of schools that are really actively promoting these opportunities to their students. So this year, we are also asking you to report your ongoing and one-time events separately within this section. So that's where you'll see these, the separation here. And ongoing health, wellness, and fitness means participation in at least 6 sessions for whatever the opportunity may be. So for example, if you're running a SOFIT program, please report here only the number of participants who attended for at least 6 sessions. And the way to track this information, a lot of programs have found it helpful to keep attendance at each of the sessions so that you'll be able to just report on these overall numbers for each of the categories. And then when we get to our one-time health, wellness, and fitness, that means participation in your one-time events like performance stations or health education stations. We also have this specific tracking tool here below to help you keep track of each of these so that you can report on sort of these big boxes up here. And these have built-in drop downs as well. So in this example, you're implementing a fitness program. It's SOFIT, but we have all of the options available here for you to just indicate which one you've been implementing. Each of these rows should count as one opportunity. So that's how you would add up and count these health, wellness, and fitness opportunities up here. We want to know where this program took place. So we also have an option for online here. So this is how we'll be capturing if you've transitioned to any virtual programming or live workouts or anything like that. Just tell us about it here. I know that a lot of the pivoting that you've been doing and the programs that you've been implementing now may not necessarily fit very nicely into these categories. So we have another option here as well for you to tell us a little bit more about what you're doing. Again, for those this applies to, we want to know if this activity took place in your geographic focus area, the overall number of athletes that participated, and then specifically we want to know the number that are participating in 6 or more sessions, and that is what you'll report up in these big boxes. So you'll be able to sort of add all of these columns to sort of seamlessly report in the big boxes up there. And so we'll be asking this in this similar way for each of these categories. So athletes, people with ID who are not SO athletes, unified partners, and then family members and caregivers. So for each of these activities, we'll ask you to give us a bit of a description of the activity. And then again, we are going to ask you to sort of assign percentages that add up to 100 that correspond to the age groups that were represented within this programming. And then generally, we will ask you the impact of this activity. So are participants more physically active? Or have you noticed that they've been practicing healthy behaviors, setting fitness goals? The more specific stories I think that you can report here, the better as well. And again, Lilia, we'll talk a little bit more about that in a bit. I'm going to
Molly,
pause here. Yeah. Great.
Yeah, but just that's the same question twice, basically.
Okay.
For schools
Yeah.
who are participating in Unified Champion schools would be counted in this total as well, correct?
If they are implementing health, wellness, or fitness activities, yes.
Great.
That's a good question.
The question. Yep. Anybody else who has questions, feel welcome to type them in the chat or unmute your line. But right now that's, oh, here's another one. What about, Walker, do you want to just unmute your line and ask? I'm not sure your question.
What about unified schools that would just have their participating kids do our activities? So they're not necessarily implementing something on their own.
They're not necessarily implementing something on their own. I'm not sure I understand the question. So they're part of the unified school and just doing the activities sort of implemented by the unified school, or
so like if a unified school had its athletes and its students participate in a one of the activities that we put on.
Okay, I believe so. I'm going to follow up with you on that question. I believe that they should be counted in this overall schools number as well. It sounds like we would want to count that, yes.
Thank you.
All right, that's the question. Those the questions that have come in so far. I'll let you know if I see more.
Great. Okay, so I will move on to this next tab. So training and activating health advocates. You will be asked to report on 3 different types of health advocates in this section. Your health messengers, family members and caregivers, and coaches. So in addition to the overall number of trainings and the number of individuals trained, we'll need to understand a little bit more about your work with family members and caregivers. So there's a specific tracking tool for that below that I'll go over in just a bit. But I just wanted to mention that for each of these categories, essentially what we're interested in is the number of events that were held to train these individuals, and then the number of athletes that were trained as a result of this training. And then subsequently after that, we'd like to know the number of health messengers in this example who are actively promoting health, wellness, or fitness in your communities, in your program, and among partners. So similarly for family members and caregivers, we'll want to know the number of training events held. All of these are going to apply to both in-person and online training. And so in the Qualtrics report, you'll have an opportunity to tell us specifically which of your events took place online and which were held in person. So for family members and caregivers, the number of trainings that were held, the number of family members or caregivers that were trained, and then of those, the number of trainees who are actively promoting health, wellness, and fitness to others. And if you are receiving a Family Health Forum grant, this is where you'll be reporting a majority of your information as well. So we'll also want to know the number of athletes and other individuals with ID that have been educated on health, wellness, or fitness at this training, as well as, and this likely only applies to Family Health Forum grantees, but the number of Lions Club members educated on health, wellness, or fitness, as well as the number of other volunteers who are trained in a similar way. Finally, we will want to know about the coaches trainings that you've held. So the number of trainings for each of those, the number of coaches that were trained, and then of those, the number that you think are integrating health, wellness, or fitness into sports practices. So then this bottom section again, sort of like the last tab that we went through, we'll just want to know a little bit more information about each of these trainings. So we'll want to know the date of the training, whether or not it took place online, if it was part of a family health forum. We'll want to know specifically the topics that were covered. You won't have to write any of this out. You'll have this list of options available for you to select. And then based on what's selected in this question, a few more questions may come up. So if COVID-19 is selected, for example, you will have to tell us a little bit more information about that. specifically whether or not you provided resources and education about prevention as well as treatment for COVID. And then similarly for diabetes, all of these questions are related to the diabetes programming. So if you are offering this, we'll want to know if you offered a blood glucose screening, how many people were screened, et cetera. I won't read through all of these as this will only apply if you do select that diabetes specific training. Okay, so this section is on training healthcare providers and health workers. So this section is going to focus on how you're training and partnering with organizations in your community, including governments and hospitals, community partners, to be more inclusive of people with ID. So you may be training partners on how to include people with ID, see these partners make specific changes that you think facilitate inclusion of people with ID in health settings. And so you'll answer these questions, of course, to the best of your ability. And if you haven't worked with any partners on inclusive health up like through this point, please let us know that you just haven't started this work yet. And I know that there's a few terms that are listed here that I just wanted to go over some examples and definitions before we dive into what's necessary to report. So inclusive health policies are going to be, for example, expanding insurance coverage to include people with ID, or requiring that buildings and parks are accessible for people with ID. Examples of inclusive health practices are using plain language, considering preventable causes of disease and death when you're making diagnoses, and ensuring accessible exam tables. Examples of inclusive programming are going to include adapting a diabetes prevention program or a mindfulness program for people with ID by changing the content, by incorporating more repetition, or by including examples that specifically pertain to people with ID. So we will ask you, similar to the last section as well, the number of training events that you held for healthcare providers or students outside of Healthy Athletes. So overall, when we try to understand the impact of our programming, we will we'll combine these numbers with what you report in your Healthy Athletes section. So make sure to keep in mind as you're filling out this tab that everything that took place within Healthy Athletes, you should be reporting in the Healthy Athletes section, and anything outside of that, you'll report here. So continuing to go through, you'll tell us about the number of healthcare professionals that you trained outside of Healthy Athletes, number of students trained, number of fitness and wellness professionals trained, frontline community health workers, and then we'll specifically want to know the number of trained health or fitness professionals, students, or organizations that made changes to their services or programs to promote the inclusion of people with ID. So I will, I'll go over that. I know that's a big sentence with a lot of words in it. So I'll just go through in depth down below, just how to track that information and make sure you're reporting on those changes. So we'll ask first for this overall just free text response of telling us a little bit more about people or organizations who have deliberately taken actions to include people with ID in the community. So moving down here, each of these rows that you'll report on is going to represent a specific individual training that you held. So you'll tell us what the training was. You'll tell us the type of organization or professional who you think made a change to be more inclusive. So it could be a health professional or fitness professional, a payer insurance company, a community organization, or something else entirely that you'll have the opportunity to tell us a little bit more about. We'll ask for the name of the organization and then specifically the changes that you think were made. And so this won't be a free text option. You'll have all of these options that are listed here to choose from, and you'll select whichever of the options apply to the changes that were made. So in this example, we've selected training and incorporation of ID into practices, adapting resources to ensure that those resources are accessible for everyone. If you do select a change that affects students or a change that took place in a university setting, a few questions will pop up to help us understand, for example, how many students this change could potentially impact. And then we'll ask you more specifically about if it was a curriculum change, for example, what you think how these options could apply to the curriculum change that was actually made, and what you think that impact is. And then similarly, if changes were made by healthcare payers, you'll see a series of options like the ones that are listed here to help us understand what the overall impact of this type of change could be and how many people it could potentially affect. Right, I will move to this last section here. So finally, you'll be required to report on 3 areas regarding how you're working towards systems change and sustainability. So the first is sustainability. The second is partners in VIK. And then finally, we'll talk about raising awareness. So in the sustainability section, it's just going to be this one question where we will ask you to respond to each of these statements and tell us whether or not the statement applies or does not apply to your program. In Qualtrics, you'll also have an opportunity to sort of rank the importance of these statements. And it'll sort of be a drag and drop, but for here, you'll be able to select this applies to my program or this does not apply to my program. Within the partners and VIK section, this is going to require you to upload your partners list. The partners list is embedded in this tool. So if you just click this link, it will take you to the partners list. I'll talk about that a little bit more in a bit. So we'll ask first, this is a free text response, not a numeric response, but just to tell us about the overall impact of the partnerships that you've made and developed on your health, wellness, and fitness activities. Here is where you'll just upload your partners list seamlessly. And then you will tell us about the total amount of cash. Again, we've separated cash and VIK this year as well. Overall that your partners have contributed to. And so I will actually go through the partners list now. So I know that there have been a few versions of this floating around. So please make sure that you're using the version that's in this tool so that we can be consistent and share across programs all of this information. So we'll ask for the partner name. If it's a new partner since the last time you've told us about your activities, the type of organization this is. So if it's a university or a healthcare provider or something else entirely, you'll tell us that here. The year the partnership was established, and then specifically what this partner contributed to. So did they contribute to healthy athletes, to follow-up care, to your health, wellness, and fitness programming. And then overall, you'll tell us about the partnership. And then this tool also allows you to sort of individually track by partner the amount of cash and the amount of VIK that the partner contributed. And so if you do keep track of this, you'll be able to sort of add up each of these and report in these overall numbers here. This last question is a new one this year that I wanted to highlight. I know it might not be that easy to get this contact information from the partner, but if you have it, it would be great for you to include it here. So just names and email addresses and phone numbers, if they're available, this is a space for you to provide that as well. I will just go back here to finish this up. So if you are reporting any articles or presentations, you'll be asked to tell us the month and year that the articles were published, as well as their titles. And then you'll also have an opportunity to upload the resources directly. So we're interested in the number of articles and presentations that have been published in academic journals. And then similarly, we're interested in the number of articles or presentations that have been shared on websites or blogs or newsletters. So I think that is it for me. It looked like there might have been a couple questions that have come in.
Yeah, there was a question about whether there was a monetary threshold for calling an organization a partner. And we don't have a monetary value. And in fact, the partner does not need to be contributing cash to your program in order to be counted as a partner. You could have a partner who is seeing athletes for care after an event. And even if they're charging those athletes, if they're charging their insurance or charging them a fee, it would still be a partner because they're accepting the athletes, they're providing that care. A partner could be a university that is training their students on how to work with people with ID, and maybe they send some of those students to a Healthy Athlete event. Those types of partnerships count as well. And I think those are all the questions that have come in. Of course, anyone's welcome to unmute your line and ask. And while we wait for that, just a couple of reminders. This Excel spreadsheet, your regional health manager should have shared this with you in an email, but we'll also be sharing it again after the webinar. This webinar has also been recorded. We'll post it up on resources, so you can come back and listen to it again if you would like to. And if you have any questions as you're looking over the materials or later as you're filling out the report, please don't hesitate to reach out with questions. We would much rather that you ask a question than be confused in some way in filling out this report. And we also, Molly said this at the beginning, we use every single piece of information that's in here. This year is especially important because we are working on the next 5-year SOI strategic plan. We also will be approaching our two main funders, the Golisano Foundation and the CDC, about what the future looks like with all of them. And so we have a little bit more in this year to get to the heart of the work and the impact we're having, so that can help us with those two proposals as well. So we appreciate all the time that you will all put into putting this together. And Susie, I see your line's been unmuted. Did you have a question to ask?
Oh, I did. Thanks, Annalie. I was just curious, the impact of COVID on everyone's programs. Has everyone been like majorly disrupted? Like, I just know that, we're in lockdown. We came out of lockdown and now we've got some states have gone back down into lockdown again. In terms of the training opportunities and the face-to-face training, the Healthy Athlete programs and things like that, have people been, I'm just assuming it must be incredibly disruptive for some of a lot of the programs in the States. And I'm just curious, what the impact has been on the healthy athletes or the healthy communities, or as you said, have we just all pivoted to try and have the most impact that we can given our current circumstances?
Yeah, it's a really great question. So I think the place where we've been hurt the most is in offering in-person Healthy Athlete events. That's globally. We just have not been able to safely offer in-person Healthy Athletes to our athletes. We haven't been able to hold competitions and events. And so those numbers are really down, but for good reason. We want our athletes to stay safe. What we are starting to see is programs, and we'll be coming out later this fall, October or so, with guidance on how to do some small virtual Healthy Athlete events. So we hope to still be able to offer some of that. And through Healthy Communities with the follow-up care, we still are hoping that you're working to find ways to connect with athletes who need care, who maybe have come to events in the last year, who needed follow-up care at that time, and that you're talking with them about whether they have got those issues resolved. So we hope that the follow-up care piece contributes. In terms of some of the positives that we've seen is that while programs have been shut down for the pandemic, really what we've been able to offer our athletes is health, wellness, and fitness. We've been connecting with them on topics like how to stay physically fit, how to stay mentally and socially connected and healthy. And everyone, athletes, families, coaches, have been looking for that continued connection with Special Olympics. And what we're able to offer right now is our health and wellness and fitness programming. So we've seen actually a big uptake in that type of work as well. And so it will be interesting to see the data that comes in at the mid-year report. We definitely expect things to be a little bit lower than normal, but also won't be surprised to see some activities like the virtual fitness programming really take off in ways that it hadn't before. So hopefully that answers your question. And yeah, and that's great. That's where you're focusing your efforts. I would say the other two things, training health messengers and then working with partners to make sure that people with ID are treated equitably and have access to care during the pandemic.
Yeah, that's great. And that just, I guess, reassures me that we are sort of going in the right direction here. One of the things I messaged Jamie Bellis was about with the online training, and I spoke to Jeannie in Wisconsin as well about what tools, are there any like pre-training tools that we can share with athletes about, online etiquette when you're doing training, because we set those rules and we do face-to-face training, but, some information on how to use Zoom meetings, what the etiquette is, that kind of thing, because we wanted to do a small group training just to trial it online to see how it went. And then someone said, well, not everyone's got that technology down pat, and we're just trying to see if I just wondered if anyone from the group has done any online training and how they prepped athletes to participate in that online training as health advocates or health ambassadors within their, for us it's our clubs. We're going to concentrate on a couple of clubs to get that done first.
Yeah, great question. If anyone on the line has experience with that they want to share, I can also connect you with some of the programs who are on this morning session who I know have done virtual trainings with athlete leaders. And
that would be great. Yeah. Thank you.
You're welcome. Let's see. I also want to make sure we have time for Lilia to share her section of the presentation. Lilia, are you seeing my screen that's a full slide?
Can you hear me? Hello.
Yes, now you can.
Yay! Hello, everybody. Hello. My name is Lilia. I am on the communications team based in Washington, D.C., where it's close to 10 p.m. right now, so I look nothing like my Zoom photo. But I'm excited about this very brief presentation. I have a good feeling about this group. We had another similar meeting 12 hours ago, which means I listened to Molly's presentation twice now. But it also means that I had 12 hours in between to really think how well our two portions kind of fit together. So storytelling is an important part of reporting. And the qualitative part is very, very important, especially in years like this year, when we kind of like, we're hearing new stuff, like the healthy athletes screenings are not what they were a few months ago. Events are not the same they were a few months ago. Even regular doctor's visits are not what they used to be a few months ago. And it's very important to draw attention to those stories. From where we sit in Washington, D.C., the reality is very different from what you're seeing in Australia, in Singapore, Malaysia, and so on, Hawaii, and so on. So that's why we wanted to talk today about the importance of collecting those stories. And at the end of this presentation, I'm going to leave you with a link to a story starter template. And many of you are already successfully using it and submitting great stories. And if you are one of those people and are on the line, please feel free to jump in the presentation or at the end to offer any support to other colleagues or to offer any thoughts, questions, ideas on what we could do better, how we could improve the form and whatnot. We're here to listen. And to other people, story writing is still a bit intimidating, and the template will be a great starting point. So it is important to remember that your communications colleagues in your program, and if you don't have communications colleagues in the program, you all have regional communication support. And even us at the headquarters, it's two of us doing communications for health specifically, but we're here to help you. And please don't be intimidated to tell stories. We're all great storytellers. I follow many of you on social media. I see your writing. So why do we need stories? Because that's the best way to introduce others to our work, talk about our impact, and bring in additional resources. And most importantly, to get our ideas to stick. And the recipe for making ideas stick, finally, you can switch to the next slide because it's more fun to look at than just listen to my voice. All right. So the recipe for making ideas stick is essentially the same set of ingredients that you can add to any piece of content to make it more likely to be remembered. So, and by that I mean, like it's a written story, it's a presentation that you give, it's a meeting that you do, with potential partners, donors, and so on. You tell the story the same way. So how can we get the audiences to remember our ideas? And I'm going to share with you just 3 very, very brief principles of stickiness. And you have them on screen. Let's move to the next slide, Annalie. So let's start with simple. Tell people 10 things and they're going to remember none of them. And if you tell them one thing, they're going to be more likely to remember it because memory can only focus on so many things at once. We need to constantly look at ways to simplify our stories. Too often when we communicate, we say that this idea can't be simplified, and we hear it very often in health. Our work is very complex. It's too nuanced. I can't say it, in a simple sentence. And we think that we need to tell people everything to make sure they get the idea. But importantly, if we tell them everything, they're going to remember nothing. And this is something that I can't, stop emphasizing. So we have to think about one, maybe top 2 things that are important to a story, and then focus on that one thing and add as many details as possible and as interesting to that one thing. So for example, if you're telling the story of an athlete, what's relevant now, the COVID, somebody trying to get a test and they're not getting it, why is that happening? Let's get the details of that story versus, going on tangents that, well, this athlete also did a screening in the past and, stuff that's not relevant potentially to the story. It's an athlete that has been volunteering for a long time. Once you start going on those tangents, you kind of lose the gist of the story. Next part, the stickiness principle, is using data wisely. Annalie, we can skip to the next. Yeah. So usually when we think about getting people to believe our message, the default tendency is to use statistics. We think if we use a lot of numbers, we are going to sound more credible to the audiences. And of course, numbers can be useful. If Molly is on the line, she's not happy with me saying this right now. Yes, numbers can be useful, but they are not memorable if we deliver them, in big quantities and especially if we're not contextualizing them. So I'm going to give an example, a simple example. So imagine that you want to convince athletes that movie popcorn has a lot of fat. Or imagine that you're trying to convince me that movie popcorn has a lot of fat. So you can say that movie popcorn has 40 grams of fat in it. Wow, that's a lot. Or is it? Like, what do we know about that number? It's bigger than 30, smaller than 50. Like, what does it tell us? So what if instead of delivering that number, you also accompanied it with an example? That's more fat than in a bacon and egg breakfast and a Big Mac with fries for lunch, taken together. That's how much fat is in a small movie popcorn. So that's one way to deliver the message in a more impactful way, like you capture the audiences differently. So let me bring this home a bit. We all use the statistic, or at least at the headquarters level, and I'm sure you have the equivalent at your program level. So we have conducted over 2 million free health care screenings in over 20 years. Great, but for Story, this means nothing, because what's 2 million? Again, it's bigger than 1 million, smaller than 5 million. We don't really know how much is that. So let's try to dive into that. Okay, well, that divided by 20, it brings us to about 100,000 screenings a year. It's a big number, but again, like, is that big? Is that not? So if you keep doing that math, you can say that you're doing 12 screenings per hour, every single hour, day and night, no time off, no weekends, no holidays, for 20 years. That's how many screenings we're doing at Special Olympics. And I've seen our athletes actually do a great job using data wisely, as we say, on social media for the past few months. There have been some interesting competitions and challenges going amongst our athletes. I see some of that in the Health Messenger group on Facebook. So folks start saying, I lost 5 pounds, I lost 10 pounds. And some of them started saying, well, I lost the equivalent of a car tire. That's how much weight I lost. Oh my goodness, well, that puts things in perspective. Now I think that I'm walking around with an extra car tire after COVID. Let's move on to the next principle of stickiness, and that's making stories emotional. How do we get people not just to listen to what we're saying, but to care, and therefore to remember what we said? And I'm going to bet that the last viral video or story that you posted on your social media, or something that you sent to your family, friends by email, it had an emotional component to it. The more it pulls us in and plays on our heartstrings, the more likely we are to care and to remember what the story had to say. And as we apply the idea of emotion, think first about which emotion you want to get people to feel. So sometimes we want people to feel angry, and sometimes we want them to feel anxious and to see that there is need for our work to happen immediately. Sometimes we want people to be surprised with what we're doing and the results that we're achieving, maybe even excited about the work that we're doing and that they're contributing to that work. Think how you can play on the emotion when you're designing your story message. And to help you do that, there is a useful tool called, kind of in the communication industry, the 3 whys. And it's very simple. So you ask a question and you follow it with why, and then they respond, and you follow it with why again, and then they respond, and you follow it with why again, until you hit the core. So let's see an example. Let's say an athlete, Joanna, does not like going to her regular eye doctor, but she was very excited to go to a healthy athlete screening. Oh, good. That's an interesting beginning to a story, but that's not the story itself. So let's ask Hannah, why? Why did that happen? Why were you excited? Well, she'll tell you that last time she went to an eye doctor, she overheard him tell her mother that he does not treat her kind. All right, so that gets a little bit more to the emotion. Did she feel sad? Did she feel angry? There's no way to know unless you ask her why, Hannah. And Hannah is going to tell you that she does not feel like her disability makes her vision any different than the vision of her mother. So she doesn't see why the doctor didn't want to see her. You keep asking those questions, why, and you'll see that you'll get more interesting content from that story, from the individual. So sure, this example is not the most emotional thing ever, because we spend just a few seconds thinking about it. But by asking those three whys, we begin to think about a more emotional way to convey our messages. If you feel that you want someone to remember what you have to say, don't just communicate information. Try to pull on the heartstrings. Another thing, that I find useful when I'm writing stories is try to avoid talking about abstract things. Try to focus on concrete things. And let me give you a very quick example. You hear on the evening news that the rate of violent crime went up. Okay, well, that's appalling. But here's another way to say it. The rate of murder, rape, and theft went up. If you're anything like me, that probably brought up a whole different set of emotions. Let's see another example. For example, the government collects money to help our nation accomplish the things it needs to accomplish. All right, well, beautifully said, but very abstract. What does it mean, So here's how you would put it in concrete terms. The government collects money to build roads, preserve national parks, feed the poor, and defend our nation. Okay, so that brings up different kinds of emotions. Let's bring this home a little bit. So, for example, over the past few years, John experienced significant challenges in accessing health services. We operate with that phrase a lot, actually. Okay, it sounds good. It's beautifully written. But does it bring up any emotions? Not in me. I don't know. To turn it concrete, I would say John was not able to get a chest x-ray twice over the past 5 months because doctors at his local clinic were not trained to treat patients with intellectual disabilities. And that's something that we can address through our Special Olympics work. So try to avoid operating with abstract terms, speaking concrete language, and that's very, very helpful to writing a story. It doesn't have to be written in very beautiful words. The story is more powerful when it's simple and it's concrete. So we're here to help you get the story out, and that's why we drafted the story starter template that's on our resources page. I outlined the steps. Unfortunately, my computer crashed, so I don't see the presentation in front of me, but I outlined the steps on that last slide. One very important part I want to draw your attention to. It's very important to add photos with the stories. If you have videos, fantastic, but usually, photos will do. Especially if you're telling a before and after story, especially if you're talking about, an athlete. Let's say now many of the athletes talk about doing fitness at home and losing weight. If you have a before and after photo, that story is invaluable for our website, and it does really well with the media. It makes it easier to pitch. Same, if you have a healthy athlete story, we have a lot of dental stories, like somebody got a follow-up care through a partnership and, got their teeth fixed, but there is no photo from before and after. And we get, beautiful quotes of wow, their smile changed, but there is no way to actually show that. And it's very important to get the photos. What happens to those stories? Well, many of them end up on our website and they get a lot of traction. We have a lot of athletes reading, we have partners reading, we flag stories to our partners individually over email, we put them in newsletters. But more importantly, we pitch those stories to the media. And sometimes we become very heavy on stories from one program, but not from programs around the world. So it's very, very valuable to see stories from everyone and to understand the struggles that people with ID are facing, not just in the United States and not just in Washington, D.C., but in, Australia, in Nepal, in Malaysia, like in all parts of the world. So I'm going to take a deep breath and pause for a second and see if there are any questions. Annalie, help me please, because I don't see the screen in front of me, the chat.
No questions coming in yet, but of course anyone is welcome to ask a question, and you can unmute your line or enter it in the chat box.
My feelings are hurt, guys.
Yeah, just thank everyone for joining the web. I know we're a few minutes over, but I appreciate you all staying on the line and asking such great questions as we've gone along. And so if you have any other questions we can help answer for you at any point, please let us know. And we'll be posting this recording soon so you can come back and reference it at any time. And thanks so much for joining us today. It's a pleasure talking to all of you as always.
Thanks, Annalie. Bye.
Thank you.
Thanks, everyone. Have a great
Thanks, everyone.
evening.
Have a great day.
Where you are.
Yeah.